Whether you're trying for your first pregnancy or your fourth, it's always important to know how to find your fertile window. On today's episode, we're sharing our top 3 tips on how to find your fertile window.
Are you currently trying to get pregnant? You should check out our Preparing for Pregnancy guide. Visit www.shefoundhealth.com/PFP to download your copy today. We'll also link to it in the show notes below.
When trying to conceive, the first step is determining your fertile window. So what exactly is your fertile window? It's generally considered the first 5 days leading up to ovulation and the day of ovulation.
It's important to know roughly when you ovulate, as the unfertilized oocyte, or egg, typically only survives around 24 hours unfertilized, while sperm can survive for up to 3 to 5 days inside your cervical mucus.
So let's get started with tip number 1, basal body temperature monitoring. After you ovulate, progesterone rises and has a number of effects on your body, including increasing your basal body temperature. To effectively measure your basal body temperature, you need a special thermometer that can easily measure to at least 1/10 of a degree.
Then comes the tricky part. You have to take your temperature every morning while still in the basal state. This means before you get out of bed, before you use the bathroom, before your morning cup of coffee. There is a normal amount of variation with your temperature daily. A persistent rise in your body temperature after ovulation can be detected in the luteal phase, which is the second half of your menstrual cycle after ovulation.
Detecting a temperature change during your current cycle is too late to be useful for timing, intercourse, insemination to conceive in that cycle. However, it's useful for tracking cycles and timing of intercourse, insemination for the next cycle and observing a pattern over time.
For most women, their basal body temperature fully at rest is between 36.1 degrees Celsius and 36.4 degrees Celsius, or between 97 and 97.5 Fahrenheit, before ovulation. After you ovulate and an egg is released, your basal body temperature increases to somewhere between 36.4 to 37 degrees Celsius, or 97.5 and 98.6 Fahrenheit.
It is important to understand that there are other external factors that can affect and alter your basal body temperature. Being sick, having your sleep cycle altered, etc., can alter your temperature. So it's important to keep in mind that basal body temperature monitoring is not about predicting ovulation, but rather it's useful in establishing a pattern of ovulation over time.
And if you're wondering if there's an app to help you, there certainly is. There are a few apps that can be helpful in tracking your temperature, like Clue, Glow, and Kindera. We don't recommend one over the other, so check them out and see which one might work for you.
In addition to basal body temperature monitoring, learning how your cervical mucus changes throughout your cycle can be extremely helpful in tracking your fertile window as well. Changes in your cervical mucus are caused by changes in your hormone levels, both estradiol and progesterone.
So, as estrogen levels rise before ovulation, your cervical mucus becomes thinner and stretchier, which allows it to be penetrated by sperm. After you ovulate, levels of progesterone rise, which cause your mucus to be thicker and become impenetrable to sperm.
As you approach ovulation, typically you have an abundant cervical mucus and will notice increased vaginal discharge. You can check the mucus from your pad or gently insert a clean finger inside the vagina to get a small amount of mucus on your finger.
There's actually a test called spin bucket. Do you remember learning about that in medical school?
Yes, It's in the recesses of my mind.
So the spin bucket refers to the stretchiness of your cervical mucus. There are a multitude of images on the good old internet that will show you what your cervical mucus should look like when you're fertile.
In terms of your cervical mucus changes throughout your cycle, here's what you can expect in a 28-day cycle. Day 1, we consider the first day of your menses. So most women, somewhere between day 1 to 7, they have their menses. Day 7 to 10, they have minimal to no secretions. Day 10 to 13, there's scant, cloudy, sticky, a little bit thicker secretions. Day 13 to 16, you have abundant, clear, wet, stretchy secretions, and this is generally the time around ovulation. Day 17 to 28, you have a reduction in the secretions followed by no secretions until your next menses. Now, important to realize this is not exact, but this is typical for a 28-day cycle. If your cycle is longer than 28 days, you should expect more days with minimal to scant secretions.
Lastly, we want to talk to you about urine ovulation kits. There are a few different types out there. The most common test looks for a rise in luteinizing hormone, LH. The LH surge, which typically happens about 36 hours before an egg is released from the follicle. You can then see the LH rise in your urine about 12 hours after the surge.
Given that we know that sperm can survive inside your cervical mucus for upwards of 5 days, and an egg only survives for approximately 24 hours unless fertilized, it's ideal to have sex before you ovulate to ensure that you've got sperm waiting inside when the egg is released.
We often recommend women testing a few days prior to the expected surge so that you can see the increase in baseline levels. Remember to use them exactly as described on the kit, as some are standardized to different times of the day.
Many women find them helpful to confirm their other tracking measures, such as their cervical mucus or basal body temperature rise. They can help you learn more about your cycle and help to predict when you ovulate. These are definitely less helpful if you have irregular cycles, as it can be costly to test daily for weeks or months at a time. If you don't have regular cycles, you should see your care provider to get more details about why your cycles aren't regular.
And it's important to know that anyone who has a medical condition that can be associated with hormone dysregulation or on hormonal medications shouldn't use these tests. These conditions include polycystic ovarian syndrome, PCOS, and premature ovarian failure, to name a few.
We hope that this helps all of you families out there who are trying to conceive. Are you using ovulation test kits? Have you been tracking your cervical mucus or basal body temperature? What have your experiences been? Please share in the comments below. Now, if you found this topic useful and you like the information we're giving you, then make sure to subscribe below and leave us a 5-star review. It lets us know that we're getting information out there that people actually are using. So check out our website at www.shefoundhealth.ca. Make sure to join our email bump blast every Wednesday to get informed on all of our free content getting out and if we have any special deals for you. Have a great day.